So hi everyone, welcome to our InnoHSupport webinar. So this webinar is part of a series of webinar organized in the framework of this European project. So today we are going to dive into the innovation procurement. So why innovation procurement is relevant for healthcare organization. So first of all, I want to share with you some housekeeping rules for the session. This webinar is being recorded and it will be publicly available on the InnoHSupport webpage and social media channels. So please keep your microphone off, so all participants must be muted to avoid any background noises. And during the Q&A session, we will address the question you type in the Q&A box. As you can see, you can find the Q&A box at the bottom of the screen. So feel free to type your question and then we'll address them during the Q&A session. Also, if you want to share any thoughts during this Q&A session, you can raise your hand and I will give you the floor. So this is our panel of speakers for today's webinars. As I mentioned before, we are going to dive into the innovation procurement topic. So the innovation procurement is a strategic driver for healthcare transformation. And we want to provide you with the information on how healthcare organizations are implementing the innovation procurement practices. So my name is Maria Bernabé. I am European Project Manager at Ticbiomed, the digital health cluster based in Spain. The webinar is organized by the project and moderated by us, Ticbiomed, as a project partner. And we have our director at Ticbiomed, Jorge González. Then we have two real use cases from two InnoHSupport beneficiaries. They are Carlos Larrañeta from Fundación Progreso y Salud. He's the head of public procurement of innovation of this entity. And Elena González, it's the innovation manager at Hospital Universitario del Sureste. So first of all, I will want to give you an introduction about the project and an opportunity that we have for healthcare providers now. Then we'll move to the topic itself, why innovation procurement is relevant for healthcare organization with Jorge González. Then we have the opportunity to hear how the Andalusian public health system is implementing innovation procurement, the strategy that they have defined. Finally, we have the advisory services beneficiary, Elena González from Hospital Universitario del Sudeste, that will present a specific real case on innovation procurement, how they are implementing in their organization. So we have at the end of our Q&A session, as I mentioned before, we finally wrap up the session and provide you with some next steps. So let me present you the project briefly. So InnoHSupport has the main objective to boost the uptake of innovation in the healthcare sector through the strategic use of public procurement of innovation. We are trying to bring all the main actors involved from the ecosystem, so such as healthcare providers, suppliers, and investors. We are creating a robust network of public and private actors to facilitate the innovation procurement practices so they can start implementing practices on innovation procurement. And also we are providing capacity building program and executive education to equip the healthcare organization teams with the skill they need to manage innovation procurement properly. We are also establishing a digital hub called Agora. So this is a matchmaking space where all the ecosystem can access and interact among them. So they have the opportunity to share knowledge and best practices on innovation procurement. And last but not least, for these European projects, we are promoting sustainable procurement strategies that aligns with environmental goals that are currently. This is for regarding the project. We are the consortium is made up by 7 organizations across Europe. We have consultancy firms, cluster companies, and public universities. So this is the main picture of the project. And yeah, considering that you are interested on innovation procurement, I wanted to inform you on the opportunity that we have open now in the project. So we have an expert-led coaching program. So this is the call for advisory services. And let me introduce to you this opportunity, as I think that it could be interesting for you. So the objective of this program that we are leading at Ticbiomed together with other 2 partners, ILO and CERMAS, is to provide hands-on guidance to healthcare organizations that are seeking to accelerate and advance their innovation procurement practices and adopt innovative solutions. So the beneficiaries that we are looking for are healthcare providers. So they are teams, more than 3 people, a team composed by more than 3 people from the same healthcare organization. And the deadline is end of March 2026, but I suggest you to apply before the end of this year, because the program will last around 6 months. So the sooner the better. So this is our suggestion, but the call will remain open until the end of March next year. So you can access to the dedicated landing page we have created with all the information. So if you want to get more information on the program, you can access the website. So I'll send you the link through the chat after my presentation. So in terms of the benefits for selected applicant, just for you to have a clear picture of what you get from our program. So you will receive tailored coaching from experts on innovation procurement. So the idea is to design the program for you. So we have general methodology, but then we will adapt to your organization needs. So it will be a tailored program for each organization participating. So you will also have the opportunity to boost your capacity to plan and manage innovation procurement within your organization. So the main objective is to help you increase and accelerate adoption of innovation in your organization. You will also have the chance to turn innovation goals and unmet needs into real-world outputs for patient, professional, and the healthcare system itself. And last but not least, this is a good opportunity in which you can leverage the expert support that we are providing at free cost. So because it is fully funded by the European Commission, because it's offered by the InnoHSupport project. In terms of the thematic areas in which we are focusing, so we have 2 trenches. So the trench one is targeting organization at the initial steps of the innovation procurement journey. So this means that we are focusing on to define the strategy planning for the organization, to identify unmet needs, and then to turn it into challenges to interact with the market through an open market consultation. So these are the three main pillars in the first tranche. And tranche 2 is targeting more mature healthcare organization. These organizations are seeking to scale up innovation procurement. So they are more advanced, and we are providing support regarding the funding opportunities. So we help you on finding opportunities to co-create solutions with companies. We are also offering support in the tender document preparation, and finally, for the final step regarding the contract management. So this is the six main services that we are offering in the program. This is the general methodology. So in a nutshell, the program will last around 6 months. Then you will join sessions. So we will schedule individual and joint session. So the idea is to have a session adapted to your workflow and your needs, and then to organize at least 2 joint sessions with the other beneficiaries that are receiving the services. So we can give you the opportunity to find synergies and collaborate with them. And you will be assigned with with an expert coach. So you will be supported by an expert on innovation procurement. So this will be the first stage. If you join the program, the expert coach will be assigned to your team. And finally, if you are interested, you can apply to the course. So it is a super simple process. So you just have to download the administrative and proposal templates, complete the fields, and then submit it to the EU survey tool. But I will give you at the end of the webinar more details. So if you are interested, you can just contact us and we will help you. Okay, so that's all from my side. And now I will give the floor to my colleague Jorge Gonzalez that will be diving into the webinar topic. Jorge, it's over to you.
Thank you very much, Maria. I guess you can see my screen. I put it in full mode.
Okay, now thank you.
So I'm the director of Ticbiomed. Ticbiomed, we are a business association. We promote innovation across Europe, and especially demand-driven innovation, which innovation procurement is a part of. So what is innovation procurement in the first place? It's a demand-driven innovation. Okay, so the difference with the technology push is that now it is the hospital, the healthcare organization that drives the process in terms that it is them that identify what the topic is going to be, what is their unmet need, what is the challenge that they want to solve. And then once they have identified that, then they collaborate with an external, for example, an innovative startup or a small or medium enterprise in order to find a solution. Let me show you a graphical example how the process is. Okay, the typical process in a demand-driven methodology is that we start with the identification of the need. Okay, what is the pain? What really we want to solve? Then typically because you don't know the solution, if there is something that can solve that need, then you go out to the market and say, are there anything already there that works, that can help me? Or what ideas you will provide in order to make this work better for me? And once you collect that feedback, then you define the challenge. Okay, so the difference between, at least in how we talk in Ticbiomed, between a need, an unmet need, and a challenge is that the unmet need is like the first idea of the need, and the challenge is that after polishing, after connecting with other stakeholders in the healthcare organization, then you define a challenge. And that challenge is that what you publish in a call in order to find suppliers that will help you. Those suppliers apply, and then you select a number of them, and then you start the co-creation. The co-creation is that jointly, in an open innovation approach, collaboratively, both the demand side, the healthcare organization, with the supply side, the technical, the innovative company, you guys work together for solving the solution. Then there is a solution evaluation, okay? And then, in principle, the innovation part finish, and then it's up to the healthcare organization to adopt the solution, to acquire it, okay? We will talk more about this later. But this is the overarching scheme or demand driven. Now, this approach can be implemented in a number of ways. The prototypical ones and the standard ones from the European Commission are the PCPs, the pre-commercial procurement, and the PPIs, the public procurement of innovative solutions. You can see here that the PCPs they have like 4 phases, which is basically identification of the need and preparing the tenders. And they publish them, and then once they are published, a number of suppliers are selected, in this case 4, which in a funnel approach, then you end up in a prototype, okay? This is for something that is not mature, okay, that is not market ready. In the PPIs, it's actually you are procuring to be implemented in the organization, okay? So this means that the solution is much more mature. These projects, at least as they are funded by the European Commission, they take millions of euros. They get millions of euros in grants, and usually take 3 to 4 years. Okay, and you need to publish the tender in an official bulletin, so it takes a burden. Okay, they are big projects for complex projects, and you need to be able to deal with that. Now, there are also other approaches that other instruments that are also following this demand-driven approach, which are leaner and faster and cheaper than the previous ones. I just want to put here the case of InnoBuyer, a project that we as Ticbiomed are parts of, and that Hospital del Sureste, which is coming after me, Elena, they have participated as an organization. And here you can see that it is the same conceptual idea. A healthcare organization with a challenge, with an unmet need, looks for an innovative solution to do a co-creation, and then in this case there is a legal support in order to maximize chances that there is a procurement afterwards. Okay, procurement is outside of the project, but this in Blues is the same linear approach. The only difference with the previous ones is that here the co-creation only takes place with one company, and the projects are about 60,000 euros, and usually the co-creation is between 9 and 12. So it's faster, cheaper, and linear. Obviously, the scope of the project is much less. Okay, so but the point here is that you can have pre-commercial procurement, public procurement of innovation in different ways. Because here, for example, in this case, the procurement is at the end, even if it's out of the research project. Now, why innovation procurement? Okay, why, especially for healthcare organizations, why it makes sense? There are 3 benefits. The first one is the most obvious one. The healthcare organization has a problem, a challenge, something that is not working well in terms of effectiveness, in case of efficiency, and obviously there is a willingness from the healthcare organization to deliver better care. Or you want to save money. Okay, there are that in a healthcare organization, it's a very complex, very quick. With a lot of different parts in the healthcare system, so it can be clinical unmet needs, more related to the medicine. The delivery of healthcare, or it can be more administrative. Okay, it can be how to make the system work better. So in principle, it's any type of need, which of course then later in the deployment will have different rules to be solved. Now, projects, these projects, they don't change the organization, okay? No matter how big the project is, what really changes the organization is the culture of the people in that organization. So doing innovation procurement, what it helps is that personnel, I mean, people within the healthcare organization will see, okay, innovation is something good and it's promoted, and I can improve the patients' lives, I can improve my working conditions, I can improve the system because I can propose a project, because I can participate in projects that have this mechanism that say there is a problem and then there is a solution, and I can be part of this. And that can change the culture of the organization, because then you say, instead of just complaining, you move to a mode that they say, I can do something, and my organization support that. And you create a culture of entrepreneurs and a number of people that are truly interested in things made better, and then they feel they are supported by the organization. So this is more in the medium long term, but still very, very important concept. And the last benefit that I will say today is that healthcare organizations, when they enter in innovation procurement, they are not only helping themselves and their patients and society, they also helping companies to identify a business opportunity. Okay, and this is especially relevant for these startups and companies that they have great technology, but they don't know what is the right business model for them. Here, because the need comes from the customer, the business opportunity is much more concrete and valuable than just thinking in the office what will a hospital need. Okay, and the idea is that, and that's the promise, that if they can create a solution that is successful, that successfully solves the challenge, they can commercialize that solution beyond that healthcare organization, beyond the region, beyond the country. And then they can generate growth, and they can generate jobs. So they pay more taxes, and those taxes, part of them, go to the healthcare organization. So you create a circle where everybody gets benefited by the participation in the innovation procurement project, including society. Okay, so those are for the main reasons. I would say that this is the first one, the most obvious one. Okay, you have a problem, you want to solve it, but think also about the added value, which are these ones. Now, for those of you who are interested in this initially, I have two good news. First one is that there is going to be a lot of funding available in the next, at least at European and national level, in the coming years. Okay, you may know that there is in the new Horizon Europe is being discussed, and innovation procurement is one of the topics that is we think is going to be increased in terms of funding. That means that there will be more money for healthcare organizations to implement these programs in the form of grants. So all the money comes either from Europe or from your national agency that promotes innovation. Okay, so for those of you interested, there will be funding. Now, the second thing is that innovation procurement is not easy. Okay, let's put it straight from the beginning. Okay, especially if you implement these programs, the PCPs, the BPIs, there is a learning curve that you need to create. You need to invest on it. That's the bad news. The good news is that there is a lot of resources that explain how to do it. There is networks, for example, like Procure for Health. We are lucky to have here Carlos Larañeta, who is speaking after me, that is the coordinator of Procure for Health, that even if the project has finished, he has resources and connections to do that. There's a follow-up, there's another public bias community that is kind of also provide resources. We, for example, in Ticbiomed, we have a library, online library that incorporates public procurement, documentation, projects, tenders, etc. And of course, we have InnoHSupport. Okay, so there is resources, there is support, and even if I say that it is not easy, especially the first time, I can also guarantee you that it can be done. Okay, and maybe the first one is more complex, but then the second one The second one is easier, and so on and so forth. Okay, so there is help, there is support. Now, one warning, very important, at least from us in Ticbiomed. Doing pilots is easy, relatively. It can take more time, more effort, more more stress, but in principle, doing pilots, in our experience, is not the hardest part. The hardest part is to adopt after the innovation procurement, because in innovation procurement projects initiative, in some of them, the acquisition of the solution for the daily use is not part of the project. Okay, so there needs to be a strategy, there needs to be a governance to move between the umbrella of the research and innovation into the umbrella of the operations, okay, in the day-to-day that is incorporated into the system, for example, in the information system. Okay, so we know that if this is not taken into account at the beginning of the project, in the execution of the project, most likely it will go to the valley of death. Okay, it will die. The solution works, but it's not adopted, and it's such a waste. I think it's very easy to understand why this should not happen. Okay, so that's why, coming back to the first slides, this is the typical demand-driven innovation lifecycle. And what we do and what will help you to do if you decide to join us in InnoHSupport is letting you know this in green, the steps that you need to do in order to maximize chances that then there is an adoption at the end of the day. So again, if you guys are interested in getting to know more about the innovation procurement, demand-driven innovation, how to maximize the impact of your projects because they get adopted, please contact us. You all have the web link, and especially you have also our contacts. And yeah, I encourage you to join us and be brave and try to change the things from the demand side, from your challenges. So thank you very much, Maria. This is
Thank
for
you,
me.
Jorge, for such an insightful presentation. So I think that they have better picture of why innovation procurement matter for healthcare organizations. So let's go to the next presentation. So Carlos Berrañeta is, as I mentioned before, the head of public procurement of innovation at Fundación Progreso y Salud, which belongs to the Andalusian public health system. So the floor is yours, Carlos, to present the innovation procurement strategy you are following.
Okay, thank you very much, Maria. Thank you, the organization, for the possibility to be here. Let me try to, share my slides. I think you can see them now in full mode, right?
Not
Full
yet.
mode now.
Now it's pure mode. Yeah.
Okay, I have my standard presentation here related to our strategy and what is the methodology we're following up. Time constraints, we'll just give a general overview. But first of all, I would like to say that we acknowledge the benefits of procurement of innovation, as Jorge said, and we are well aware of the warnings, and this is why we are doing this way. First of all, as Maria introduced me, I'm the head of Public Procurement of Innovation, Protection and Technology Transfer at the Andalusian Public Health System, meaning that our main objectives and everything we do is focused on bridging the gap between innovation and adoption. We, new technologies, opportunities keep emerging. In healthcare sector, it's a very technological sector. And without efficient ways for adoption and uptake, the potential is always lost. So this is our main goal, and everything we do is related to that. I'd like to start by giving a quick overview of our health system, not just to provide some numbers, because I think that in order to be successful for this adoption of innovations, we have to be very well on where do we have to perform activities, which one is the playground in which we have to perform, and understanding it and having empathy towards those that have to work on it. For instance, and what do I mean by this? Our public health system is one of the biggest in Europe. In fact, there is only one, so to say, company bigger than us in Spain, and that's the army, because we are the largest region in Spain. We have a population of almost 9 million people. So you can imagine 51 hospital, 1,500 primary care centers, around 140,000 employees. So I'm saying this because, again, when we want to, the projects in which we engage in order to bring value to our health systems are ambitious projects, are not short-term projects, and are complex projects. And we have to be aware that we have to unfold these projects in a system for whom the priority is the health services, not the procurement of innovation projects, even though there is an interest on it. But this is something that we have to acknowledge. So taking this into account and believing, and I'm not going to go into the procurement of innovation instrument, but as I said before, procurement of innovation arises as an instrument with a great potential to achieve the goal of bridging the gap between adoption of innovation. Taking this into account, we start developing our own strategy because, as I said, this is complex and we need to be consistent and perseverant in our activities. So these are the main axes. Basically, it's having a proactive system to define our unmet needs of innovations, having a new structure to manage all this process, and having a program to follow up in which we have our main priority sets. These were the basis in which we started unfolding our activities, and this is some big milestones. First one is the Andalusia Public Procurement of Innovation Strategies. This is cross-sectorial. This is for the whole region. And as I said, we believe it's in procurement of innovations. So we broke down this public procurement of innovation strategy into our own program related to healthcare sector. We created our technical office, the one I will coordinate. An important milestone was this procurement of innovation project, this Procure for Health project that really increase our capacities in order to manage these complex projects, as I was saying. And then we started the breakdown of our activities by what we call the early demand map program. What is the main idea of this? As I said, I think one of the main principles is that we wanted to be proactive in oppositions to be reactive, meaning that we didn't want to react to funding opportunities in order to engage in projects. We wanted to have our unmet needs of innovation well defined and prioritized, and then let's go seek for fundings in order to do so. And these fundings can come from regional, from our own health system, national level, European level. It depends. But the main thing is that we have our needs well defined and very, very important prioritized, because I mean, there are many things in which we have to engage, but our resources are limited, so we have to have clear what are our priorities, because this is very important at the end to be successful in this adoption. And I will go a little bit on. So what we did, and taking into account these premises, is to start working on this definition of needs. Our program has 4 main pillars. Is digital health, sustainability, biomedical engineering, and precision medicine. And what we did and what we understood is that the common unmet needs have to be very much linked to the end users, mostly the clinicians. So we engage in let's say, conversations with them. That was the first steps in which we started to outline these unmet needs. We did it through workshops. These are very well thought and configured workshops because the tables, the working tables were quite defined by expertise and link it to our priorities in the programs. That not going to get into much detail because of times. Once we have those needs, we started working on them internally in our technical office, trying to answer the key issues that are shown there. Because often, because we are used to, let's say, the research, development, and innovation traditional projects, we are always thinking about the solutions. Now we have to change our mindsets when writing our needs, and we have to focus on the description of the need, the challenge, and maybe and try to develop some use cases that will help the potential developers of the solutions to understand what is our need. Once we have this done, we presented these challenges in a first, let's say, previous open market consultations to the potential developers of the solutions through other workshops. We, because in our activity, being the let's say the managers of public-private partnerships in Andalusia, we now have a very well knowledge of the ecosystem around us. So we, again, these are very well prepared and thought workshops in which we had the leaders. So I forgot to say that, but it's very important that we have for each one of the needs that we have identified, we have a clinical or technical leader within our health systems. There's the real expert on the topic to help us develop it. We had these workshops in which we presented the needs, and we asked the potential developers of solutions how will they solve it? What would they need? Is it feasible? Do they already have a solution? How much money would they need? How much time would they need? Things like this, that we then, in this third stage of our iterative process, put black over white in our unmet needs definitions. Once we had this, this is a brief picture of all the workshops and all the activities that we performed. The good thing that I like to say about this is that we were able to bring more than 500 healthcare professionals to tell us in a very well-structured way what did they need on the daily basis, what would make their life easier and allow them to provide a better health service. Then we did the official open market consultations, because this is something that we believe in many procurement of innovation projects. This is the first stage of the project. We did it beforehand because we understood that this is a very, very valuable information for us in order to be able to prioritize which of this portfolio of unmet needs we were going to tackle first. And this is the final result of all these activities. We nowadays have a portfolio of 29 unmet needs of innovations. Very well worked out already, with many different layers of description on them, with already a relevant engagement of experts within our health system in the activities. And now we have to start looking for fundings at the end, and to start working on the development of the solutions, the procurement of innovation projects. But as you may imagine, we have 29 needs here. It is just not feasible to tackle them at the same time. So it was very important now to do a prioritizations. Usually, we all know, we have all tried both approaches. Top down, there is an overall strategy, and there is the top management of the institutions that say this has to be done, or bottom up, which is okay, let's talk to the end users and then let's try to solve their problems, let's say in an easy way. Both approaches has weakness, so we decided we were going to do a mix. As I did explain, our initial approach was bottom up, but now for the prioritization, it has to be top down. In order to be successful, because at the end of the road, because we know the adoption is the value of that. It is the warning that Jorge said before. It is very important that for us, it is very important that these projects are very much aligned with the strategies of the organizations, with the top management of their organizations and the commitments they have in order to improve our health system. So the final evaluation had to be done by them. And so we define a quite simple evaluation criteria, quite simple. Simple in terms of documentation, but not simple in terms of inputs in order to do so. There you can see one thing that I like very much, which is what we call the pertinency. And at the end of the day is how much is this aligned with the overall strategies of our organizations. In a very complex organizations like ours, we have 18 strategies: sustainability, precision medicine, integrated care, primary care, you name it, and 28 plans, integrated plans. So we did a very, very exhaustive work on matching and aligning these needs with these strategies, because again, in these organizations and these are midterm projects, people change, structure change, but strategies do not change that fast. So we need this alignment in order to be successful at the end of the road. With this information that we prepared and submitted to the top management of our organizations, we prepared this evaluation criteria, and we send them our opinion on each one of the challenges we had ahead of us. We didn't want to do a rank. The one that gets the more points is the one that goes first, because there are many other, let's say, frame conditions. For instance, what I call the technical office criteria. It depends on the funding opportunity. It depends if we use own resources or Europeans or Spanish, because they have their own conditions. But we wanted to do like kind of a traffic light and say, and tell them to tell us, say which one of our projects, of these projects, is a high priority for you. Tell us which one you see interesting, but maybe not now, and tell us which one you don't want us to bother you right now with this. And this is what we did, okay? Nowadays, these are the, let's say, our circle of activities, the projects and activities we are engaged on. Starting from the back, number 5 and number 6, these are projects that historical projects already finished and already done. Some of them working on the adoptions, but let's say no longer externally funded. Right now, we launched it and we started a month and a half ago our CAR-T projects for the development of new, CAR-T treatments. We are about to publish 2 more tenders, PADIGA and PIVICRA. These are on the anatomic pathology services digitalization. We are also part in the consortium of the Teresa project. This is, let's say, a spin-off from Procure for Health, a project related to sustainability of healthcare system, specifically on-site wastewater management from our hospitals. And number two, these are all the projects that arose from our early demand map work that we have already submitted, as I said, at different levels, and to receive funding, just waiting for resolutions. And number one is the rest of the portfolio of our challenges that we have, waiting for other opportunities to tackle them. And obviously, number 0, our early demand map. This is a work that we initiated and we have to perform, but this is something that needs to be updated because challenges keep arising. So at some points, maybe not so actively to get another portfolio of another 30 challenges, but obviously we have to be able to bring new challenges and to do all the breakdown work that we've done until we see if this is a priority for our organization or not. How do we do all this? Well, with our technical office that basically, and I said at the beginning, and this is very important, these are complex projects. We want to do them in a complex organization, and the priority of the organization is not our projects. So our work is to make it as easy as possible for our health system to engage in these projects. So what do we take care? Everything that we can, everything related to the funding of the project, relation with the funding agencies, you know how this goes. Not going to get into details, but also internally, everything related to the development, the project management, and the scientific coordinations. Because these projects, and this is very important, these projects needs many stakeholders at some point of the projects. We need the scientific expert, the clinicians on board, but we will also need legal and procurement departments. We might need also infrastructures responsibles in these projects. And these are actors that unfortunately do not spontaneously engage on daily basis or on a regular basis. So it is very important that we are, the gear mechanism that makes all these parts to work together. So as I said, we try to strip them from everything that is added work that does not add value to their activities and have them as technical experts on board, and we take care of everything else. And we do this because we have a great team, multidisciplinary team. This is the picture of who we are right now, 12 persons in the management of these activities and the coordination of these activities. At the end of the day, as I said, it's a complex project and you need a team in order to tackle them, because otherwise it's just another layer of work in people that is already stressed, because health systems are stressed, and it will not be successful. So this is a very, very general overview of what we are doing and how we are doing it. Thank you.
Thank you, Carlos. Thank you very much for the presentation, and congratulations for the great job you are doing at the Technical Office of Innovation Procurement. So now let's move to the last presentation from Hospital Universitario del Sureste. Elena, please go ahead.
Tenemos que compartir.
It's okay. Thank you.
Okay, it's okay.
Yes.
Good morning, everyone. Sorry. Okay. Thank you for the opportunity to share our experience at the Hospital Universitario del Sueste in Madrid. Our presentation aims to show how innovative public procurement can become a real driver of transformation in public hospital through a practical case study we are developing called TrazaPack. But before diving into the project itself, let me briefly explain how this journey started and what motivated us to take part in the advisory service program. Our hospital is located 25 kilometers away from Madrid, attends more than 2,100 inhabitants and who mostly lives in a rural area. And it's a medium hospital, so what motivates us. Our starting point was in 2022 with Sureste Innova, an initiative we launched with the support and collaboration of Ticbiomed. And that experience was a turning point because it allowed us to look at innovation from a different perspective. We shift from a more technological or administrative vision to a model focused on the real demands of professionals. The care teams and themselves began to identify the problems they faced in their daily work. They presented then 22 different challenges in which 79 professionals from 16 different professionals categories participate. And it was they who proposed to co-create the solutions. This dynamic generated a very powerful cultural change within the hospital, our hospital. And then we realized that innovation doesn't always have to come from outside. It can emerge from within the system itself, from the needs and ideas of professionals when they have the right space and support to act on them. And perhaps most importantly, we learned that real transformation is possible even in organizations with limited resources. When there are good ideas, teamwork, and shared commitment to improve rather than depending on technology alone. We realize that innovation doesn't always have to come from outside. It can emerge from within the system itself, from the needs and ideas of professionals. And perhaps it's that I said is more important to share experience. As we didn't have an innovation unit or a technology transfer office, we organized ourselves as a multidisciplinary group of professionals from different areas: clinical care, technical, economic, and IT, working together with a common goal to improve the quality of care through practical innovation projects. Several proposals were born from that collaboration. And as part of the strategic planning process launched by our management team using the Hoshi-Kanri methodology, we gather and organize the needs identified by professionals across the hospital. And when analyzing them, we show that many shared the same challenge: clinical care traceability. The lack of patient traceability, the difficulty of coordinating tests, of transfers, and the need to improve communications between departments. That's what we decided to unite them into a single, more ambitious project with an integral approach. We call it TrazaPack. TrazaPack seeks to offer integral and real-time traceability of the patient's journey within the hospital environment, covering everything from admission to treatments, tests, and internal transfers. To make this vision a reality, we show the advisory service as an opportunity to structure the project in a solid way with the necessary methodological support to move toward an innovation procurement that will make it possible. How the advisory service are helping us? Well, the guidance from the advisory service has been instrumental in transforming a complex idea into a structured, viable project. With the help, we've been able to define the project scope, identifying the problems to solve and the essential functions the solutions must have, select the right participants, balancing clinical, technical, and management perspective to ensure holistic input, set measurable the realistic objectives. This allows us to adequately evaluate results and demonstrate the impact later, mastering the preliminary market consultations, understanding the required information and how to execute the process transparently, explore market readiness, and understand the logic and steps of innovation procurement, from defining the challenge to successful implementation. And understanding the logic steps are the basis of the process of it. Since this in our first this is our first experience with innovation procurement, this guidance has been crucial. It's boosted our confidence, streamlined our process, and aligned clinicians, management, and IT teams under the one shared vision. And what actions we are currently working on? Over the past few months, we've been advancing on several fronts. Collecting needs, we gather and systematically the needs identified by professionals using the Hoshinkari methodology, as I mentioned before. Integrating projects, several independent initiatives have been brought together under the umbrella of patient traceability. Collaborative work, we hold regular meetings with all the departments involved: emergency, inpatient care, IT, innovation, financial management, to define the scope together. Setting objectives and metrics, both at the clinical and technological level, focusing on system effectiveness, patient safety, and operational efficiency. Preparing the innovation procurement strategy. Right now, we are getting ready for the preliminary market consultation, which will help us understand the state of the art, validate our ideas, and design the next steps. But beyond technical progress, this process is creating a real culture of collaborative innovation inside the hospital. Every meeting and every discussion helps us building a new way of working based on participation, listening, and continuous improvement. And our ultimate goal is very clear, to fully develop TrazaPack through a solid innovation procurement process, allowing us to obtain an integrated technological solution adapt to our specific context. We want TrazaPack to become a tool that improves patient safety, reduce identification and treatment errors, and optimize clinical workflows throughout the hospital. In the short term, we plan to carry out the market consultation, define a suitable public-private collaboration model, and secure funding for the development and pilot. In the medium term, we aim to implement TrazaPack at our hospital and evaluate its impact on safety, efficiency, and user satisfaction. And in the long term, we hope to scale up the results to other hospitals across the healthcare system, sharing what we've learned and contributing to a sustainable, open, and replicable model of innovation. In short, with TrazaPac, thanks to the advisory services, we've learning to innovate within the public healthcare system, keeping professionals and patients at the center of everything that we do. So thank you for your attention.
Thank you very much, Elena, for the presentation. So let me highlight that, so as you mentioned, you are one of the advisory services beneficiaries. It's been such a good work that you are doing with us, so we are proud of you. And I hope this project inspires others organizations to join the program. So we will be happy to support and to guidance them in the project that they have now open. So our main objective is to help them on improve and enhance the innovation procurement practices. So I know that we are running out of time. So just for those that have 5 additional minutes, I just want to wrap up the session with some takeaways. So let me share the screen. So after the presentation that we have today, I want to highlight that, as you know, innovation procurement is a strategic driver. It's a powerful tool for healthcare organization and to transform the healthcare system. So we know after Jorge's presentation that healthcare organization can get benefits from implementing innovation procurement. We know as well that we will have more money allocated to this field, to the innovation procurement practices, but we currently have resources. So we have several platforms, tools, libraries, and hubs that can provide us with a lot of materials and resources to implement the innovation procurement. After our experienced procurers presentation, we can say that the healthcare system should assign dedicated professional and time to design to the innovation procurement practices. So we need committed teams. We really need also a cultural change within the healthcare organization. And they really need also, so they need help to transform these ideas into feasible projects, as Elena mentioned with the TrazaPac project. So we need support from experts on innovation to transform these ideas into real projects. And we have to start doing things. So we need action. Action must be taken. So as they are doing in InnoHSupport coaching program. So they are collecting needs. They want to interact with the market through the open market consultation, and finally co-create solution. So finally, we can say that we have there are a lot of opportunities. For instance, we have one at InnoHSupport project to enhance and boost innovation procurement within your organization. So we didn't receive any questions so far. So this is why I have to, and due to the time constraint, I just want to give you some next steps. So we can say that they are next step for those that are interested in our coaching program. So you just have to contact us. Please contact us to learn more about the program, and we can schedule a meeting to discuss how we can support your organization with the services we are offering. Then we can also provide you with some support in terms of the proposal preparation, so you can get assistance with the template that you have to fulfill, and then just submit the proposal. So as I mentioned at the very beginning, it's a simple process. So just to upload the PDF document through the EU survey tool, and finally you can get onboarded, so you can join the program, and we will arrange a specific meeting to assess your organization needs and find the service that fits you most and define next step. So this is our contact details. So if you are interested in our project, in one of the opportunities that we have open now, you just have to contact us through the general email. You can visit our project webpage and follow us on LinkedIn and Twitter, X, formerly Twitter. And if you are really interested in receiving support from our side, just send me an email. So this is my email address, and we'll send you the presentation after the session, so you will receive all details. But I send the link to the coaching program dedicated page through the chat, so you should have received it. But if you have to a direct contact, you just have to send me a direct email, and I would be happy to talk to you and to find a final slot to schedule a meeting. Okay, so to provide you with more information about the program and the project. So if nobody has any question, sorry, I apologize for the time, so to be late. So we are 7 minutes late, but we did our best to stick to the agenda, but we had to present a lot of content and experiences, and yeah, so just a last thing that I want to mention is that both Fundación Progreso y Salud and Hospital Universitario del Sureste are both participating in our coaching program, so they are beneficiaries from the advisory services. Fundación Progreso y Salud has just started Service 5. They are receiving support for the tender preparation documents, and as Elena presented, they are receiving support for the strategy planning. They are defining the innovation procurement strategy, and they will move them to the Service 3, open market consultation. So we'll be happy to guide them on the preparation and to setting the grounds for the open market consultation, to interact with the market and to find the most suitable solution to solve the problem that they have. So I don't know if other speaker wants to raise something. Do you want to add anything else, Jorge? Maybe?
No, I just want to reinforce your message that consider this as a great opportunity to solve the problems of your organization, and we provide support. We are here to help. So if you, it's not that you need to make the decision already, but if you want to know more, please contact Maria,
Exactly.
and we will proceed.
That's the idea. So you can contact us whenever you want. So we are open to provide you with further details and to discuss how we can adapt to your organization needs. So it is a established program and established general methodology, but will adapt the methodology to your organization needs, because you know that you don't have time to dedicate sometimes, so it will be not a problem. So we will adapt to you. So it's a super flexible program, let's say. So thank you very much, everybody, for joining. I hope this session has been useful. and helpful. And so keep in touch. So don't hesitate to reach out to us, and we can start a conversation soon. Thank you very much, everybody. Thank you very much, speakers, and everybody for joining today. See you.
Bye.
Bye.
Thank you.
Bye.